Hi, how are you today? Yeah, not so well, right, being as you're here to see me. Well, it's nice to meet you. I am Rachel, I'll be your doctor today. Can you please just tell me your name and date of birth, please? Okay, great. That's what I was hoping you'd say. So, let me just check your file, 2 seconds. Okay. Yep. Okay, so I can see that you came in last night, right? With some chest pains, some palpitations. Okay. Dizziness. And you were feeling a little bit clammy, right? A little sweaty. Okay. How about today? Are you still feeling the same way? So it comes and it goes. Right. So I can also see that they did an ECG on you yesterday. Let me just have a look. Yep, that was pretty normal. A slightly elevated heart rate, right? Yeah, that feeling. Okay. Right. So this morning we're going to do a slightly more in-depth look at what's going on and just see if we can help you, right? Good. So right now, how exactly are you feeling? Do you still have that same racing heart, that pain, or has it subsided? Okay. So I'm just going to check a few things before I check your heart, okay? So first of all, let me just have a look at your vision, if that's okay. I just want to check that everything looks right. So can you please just look here? Okay. Good, very good. Okay, and then just look at the end of my finger. Okay, perfect. Right, I'm just going to cover one of your eyes and then I'm going to get you to do the same thing, okay? So let me just cover this side, and again, can you please just look with this eye? Perfect. And the other one, just, yep, follow the finger. Good, good. Okay, so that looks completely normal, right? And can you just look up for a second? Yeah. Yep. Okay. Perfect. And if you could also just look down a little bit for me as well. Grand. Okay. Perfect. Yeah, there doesn't seem to be any problems. I'm also just going to quickly take your temperature as well. Yeah, especially because you were saying that you were feeling a bit clammy. I saw that last time we tested your temperature, it was pretty normal. So I'm expecting it to be the same this morning, but you know, we'll see, right? Okay. So can you just open your mouth for me, please? Grand. Yeah. Tongue down. Yep. Okay, perfect. Okay. 36.7. Yeah, that's completely normal. Okay, I'm just going to touch the back of your neck if that's okay, because sometimes we can have the clamminess appear and it tells me a lot if it's warm, dry, cold, clammy, that kind of thing. So do you mind if I touch you? Okay, I'm just going to come around and just pat the back of your neck and back slightly. Okay, yeah, warm and a little clammy, but it's a little bit warm in this room, right? Yeah. Okay. Right. So I can't see anything physically wrong, but let's have a listen to your chest, okay? Let's see how your heart is sounding today. Okay, so I'm just going to come in and we're just going to start down here. Okay, can you take a deep breath in for me, please? Okay. And out. Okay. It is slightly fast, considering that you're resting right now, but it kind of makes sense with what you've been telling me, right? I'm just going to do the other side of your heart. Let's see, on this side. Okay. Good. Yep. Okay, yep. Yeah, a little hard. A little fast, right? Okay, I'm just going to check down your main artery to see if I can hear the blood flowing, okay? Okay. Right. Okay. Slightly elevated rate. Okay. Okay. And then lastly, one last check around the lower ventricles. Yep, let's have a look. Let's see. Yep, pretty fast. Okay, thank you. So, everything is sounding okay in your heart. The blood flow, I can't hear any problems at all with. But you're right, it is pretty fast. So have you ever had this happen to you before? Okay. And when that happened, how long did it last for? Okay. And when these episodes happen, these painful chest pains, sorry, how often does that happen and how long per episode usually? Okay, so sometimes it happens when you're, yeah, but it usually doesn't last longer than 30 minutes or so, but this time you were stressed because it was a lot longer. Understood. Yeah. So, have you ever gone to the doctor about those episodes before today? No? Okay. So, here's what I'm thinking. As all your tests are going back normal, I think that it may be mentally related. Maybe stress, anxiety, that kind of thing. Yeah? Has anything changed recently in your life? Or are you feeling any anxious thoughts at all? Okay. Life. Yeah, life, right? I know. So, what I'll do today is I'm going to refer you on to a mental health specialist where you can have a deeper conversation about those kind of thoughts. And in the meantime, because I don't want to just send you off today and be like, bye, we're going to try a few relaxation techniques and see if that has any impact on your racing heart. Have you ever tried any relaxation techniques before? No? Well, I'll guide you along the way. So, what we're going to start with is some breathing techniques. So, I also have these anxious times, and whenever I can feel this sensation, I practice some breathing, which just helps to calm things down a little bit. Okay, so what we're going to do is we're going to take a long breath in. We're going to hold it for for a few seconds before we let it out. Okay, so it's going to be in, hold, and out. So, let's try once. Okay, so can you breathe in for me? Hold, and slowly out. Okay, we're going to do it twice more. So take a deep breath in. Hold. And out. Once more. In. Hold. Hold. And out. Let it go. Let everything go. Okay. This should stimulate our nervous system into giving us a relaxing response. Hopefully to slow down your breathing and also by proxy to slow down your heart rate a little bit. Okay, after that exercise I'm just going to double check again and see if there's any change in your heart rate. Okay, so don't mind me. Okay, it does seem to be a little bit lower, but let's continue with another technique. Hold on 2 seconds. Okay, thank you for waiting. So, what I'm going to do next is we're going to take a little bit of lotion just to help lubricate my fingers a little bit, and then I will be gently massaging some of your pressure points to stimulate relaxation, and hopefully we can reduce your heart rate a little bit further, lower your blood pressure. We'll see what effect it has. So this is something that you can do yourself at home. I'll give you a sheet afterwards with some information about the various pressure points, how long to hold on your pressure for at each point. And yeah, some people find that it is really helpful. Some people not so much, but you have some pressure points in your wrist, which I find is a good one to just stimulate whenever I'm feeling a little bit anxious and stressed. So before I put this on, again, you're okay with me touching you, right? Good. And do you have any allergies at all? Do you have any skin allergies? No? Okay, right, let me just put a little bit of lotion on then. Okay, so first of all I'm going to target some in your neck, just at the back, around your ears a little bit. People find that this pressure point here can be relaxing. And this one on this side. Okay, and then just down a little bit. Okay, perfect. Now, can you pass me your hands, please? I'm just going to start with this hand first and just gently massage that pressure point there. Yeah, holding on a little bit of breath is important as well. Okay, and hand on this side, please. Okay, and just get a massage. That pressure point there in your wrist. Okay, and breathe. Okay, and just your hands in general. And this side too. Okay, now just one last one. Back around here, okay? And just let me come around the back a little bit. Hold on. Okay, how are you feeling? How is that pain there? Not too bad, really. So, what I think that we'll do is we'll keep you in for a few more hours, monitor you and see how we get on. Before that, let me just see how our relaxation technique has affected your heart rate. Okay, so I'm just going to come back once more. Hold on. Good. Better. A lot better than it was before. Okay. Right, so as I said, what we're going to do is we're going to keep you in for the next few hours. We'll continue to monitor you. I'll also come back and give you a few more massages, see if that has any effect. We'll also do some more breathing techniques together, and I will give you a sheet of information with everything on. I'll also send that referral for you. Yeah? Okay, do you have any other questions before we finish up today? Okay, so plan of action. Refer to doctor. See patient at labs. Yep, tests. Okay, clear. Okay, please see this patient. Clinic. Yeah, don't worry. Okay, and okay, so I've sent off that referral. So expect in the mail for you to be getting another appointment for one of my colleagues to see you, probably in the next week or so. I've marked it down as an urgent request. Okay. I'll also print you off some documents, like I said, that you can take with you for some various techniques you can use in the meantime. And if you have any problems at all, then feel free to call us back. Yeah, do you have the card for... Okay, so you have for the department directly. Yeah. Feel free, if you have any of these severe pains again, call the department, ask for Rachel, and I'll see what I can do. Okay. No, thank you. Let me just... It's important to stay warm, right? I have this nice blanket. Okay, there you are. Right, spend the next few hours resting and make any phone calls you need if anybody is going to come pick you up. And, yep, feel better. Okay, give me a call if there's any issues, okay?